Hi. So how do we attend to patients that are waiting for consultation, right? What do we do? How do we go about it? Welcome. Discussing the doctor's workbench. Kelly, when you log in for the very first time, right, you will get this pop-up. It allows you to pick the branch you are in, allows you to pick particular clinic you're trying to access, and your location. All of these are setup driven. The user or the system admin will have done most of the settings um, beforehand, right? So yours is just to pick and select. Now we also will call the queue assignment mode. For automatic, all it just does is that it becomes a first come, first serve kind of system where you get to pick the most what's the word? The highest priority, patient with the highest priority on the queue. It's non-negotiable. You can't pick any other person on that queue except that particular patient that is of the highest priority, and it goes in that order to the last patient. But for the manual, it's just keeps open-ended. You can pick and select the patients you want to attend to. So for this case, I'll be using the manual, then I click on submit, right? So all it just does is that it loads up my workbench. And this workbench is pretty not just we have the waiting queue, we have the recently seen, we have the query prescription, swap requests, laboratory results. All of this can be seen from this dashboard here, right? You can even see your booked appointments. If you have an appointment, if there's an appointment scheduled for you personally, right? It will appear here. Then if there are any patients sent from the other doctor for review, you can review the patients here, right? Then if there are paid prescriptions from pharmacy, you can view them here, right? And if there are swap requests too, you can also view them. But in case in point, we have for the paid prescriptions, we have this where you can then review it, either re-prescribe or continue with the medication, according to how you'd want it to be, right? Then we also have swap requests and all of this. But typically, let's just dive right into the what's it called, the consultation part, right? Now we have the waiting queue. We have Richard, Juliana, right? First thing first is to call patients, and I will explain why. Now, the system has a robust active queue system, right? That's a robust active queue system that that helps the hospital to manage the queue in the facility. This is what it looks like. As you can see, I've called that patient and it says proceed for consultation at consulting room 1, right? Now, let me go back and say, okay, the patient is right in front of me and I want to attend to the patient. I click on attend and I click on yes, proceed. And now what happens? The there's this notification sound and also an indicator to whoever is handling the queue management system and also to the patient staring at the screen, right? And we know that, oh, this particular patient, Juliana Richard, is in session with Dr. That's the doctor's name, right? So that way it helps us um to properly manage the queue and also the patients are aware of where they need to be, right? This part doesn't really concern the doctors much. It's what there's need to have an understanding of how it works so that it will also help with understanding the reason why we need to call a patient and then attend to a patient, right? And also the reason why we need to select the location and all of that, right? So now let's go back to what we the actual bit for today, which is the doctor consultation. As you click on attend, it brings up this beautiful accordion, right? Now, on this accordion, we have the latest vitals, We can also view the vital history of the patient. We can also view the vital chart, right? We can also do other documentation, right? Typically, we have chief complaints, right? Where we can then click on new complaints, search for a complaint. Let's say edit. So the system allows you to type in complaints, and you can also pick an history using a click-based system, right? And from the predefined form, you can then select different different options that apply to that particular patient. Or let's not even say, okay, we don't want to use the click-based system. We can easily click on summary and free text. Summarizes everything we've selected, right? But it still allows us to type in patient to complain, type in whatever we want to, right? In this text, right? So once we've done this, we can just easily click on save, and that is documented, right? So we have the complaints, we have the history of the complaints, right? Typically for the review of system too, we have different systems to be reviewed: general constitution, ear, nose and throat, neck, respiratory, and easily by clicking on the new button, can easily pick from the predefined form, right? Can pick from the predefined form, then click on summary and free text, and we are good. If there's anything to be added to it, we can and then add the other review observed, right? We click on save. As easy as that. We can do for all of the systems. And a beautiful thing is, after observing all of the systems, you can also view a summary of everything that has been entered here, right? Basically. The same thing applies to the physical examination, right? Where, let me say I want to do cardiovascular, for an example. Click on new examination, click on different things that apply to that particular patient, right? All that applies. And it's not compulsory. Now, there's another thing that's it's not compulsory to pick a selection before um clicking on summary and filter. That's if you don't want to use the click-based system. But however, if you're clicking, right, if you're actually using the click-based system, there are some options that will make compulsory. So for example, look at this percussion. You say left, and it says, okay, the left, please select an option. If you don't select an option, you won't be able to save or proceed. You have to pick, oh, is it normal? Is it dull? Is it stony dull? Is it hyper resonant? You know, that way. Typically, there are controls, there are options that we feel that are almost compulsory that you need to select as if you're using a click-based system. But using just the summary of free text, you can proceed without having to select anything. For example, if you pick an option that has other options that is compulsory, then you have to select it before going um for that, right? And typically, just like the other ones, you can simply click on summary and free text, adding new examination, examination observed, and then we click on save, like saves it immediately. That is how we can also take the patient history, that's allergy history, or let's say we can click on add new allergy history and say, okay, this person, the allergy class is drug, and this person is allergic to uh, uh, an active ingredient called amoxicillin. We can pick more than one. You can say acetylphenoline, different ones, right? And then we say, so what this does is that anytime the doctor, which would be also displayed at the point of when we talk about the medication prescription process, right? Anytime the doctor picks any of this, any drug that has any of these active ingredients, system automatically flags that prescription. You can also take the medical history, easily click on add new, using the predefined form, you can select. And if you don't want to use a predefined form, you can easily just click on summary and free text and type in patient and say, so we are given two options. Either we use the free text or we use the click-based system, depending on how best works for you, right? So we also have the diagnosis, right? Which will be the one I would talk on for written before we discuss the plan. So for the diagnosis, we have the provisional diagnosis, we have the option for the final diagnosis, and this is picked from the ICD-11. Let's say the provisional diagnosis is malaria, right? Let's say, yeah, malaria with cerebral complication, safe, right? Now, after other observations, then I can